Everybody should realize their destiny and be thankful for the breath you have every day.
Knowing that we couldn't do anything to help her and that we just had to put everything into the doctors and trust that they're making the right decision.
We're all so much tougher and capable than we sometimes or frequently give ourselves the credit for.
My family, this bigger family, and the love that they poured out to me, that's what cured me.
I've been a firefighter for 15 years. And if I would say what was the most rewarding, being aware of how fragile life can be and the importance of relationship.
My husband never gets sick, and it's actually a prideful thing for him. He hardly ever goes to the doctor, and his blood pressure's low, and his cholesterol's low, and his labs are always, picture perfect, so he's really, really healthy.
Usually my workday routine starts out anytime between 4:30 and 5. I'll get up, I'll go straight to make coffee, and then go through my daily routine. But apparently this morning was different.
I heard this bump in the bathroom, and then I hear this thump, 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 thump. So I walk down the hall, open up the bathroom door, and he's on the floor, seizing. He's in a full grand mal seizure, and being a nurse for 32 years, I know you just pull someone on their side and let them stop seizing. There's not a whole lot you can do. And so I grabbed my phone, and you try call 911 when your hand is like this. It was like 92. I had to do it so many times. I just started CPR, and I couldn't believe that it was happening. And then I hear the firefighters, and then I just said, back here.
Right at the point we recognized it was Dwayne, started CPR, put on the AED, and just went through our proper procedures.
They shocked him, and he didn't come back. And they shocked him again, and he didn't come back. And they shocked him a third time, and then they got a rhythm.
From there, one of our firefighters went in with the ambulance, and we followed them to the hospital.
And the ambulance arrived just about 7:15, lights and sirens, and we were all ready for a very unstable situation. Turned out he was very stable. The most important part of Dwayne's treatment took place before he got to Wilcox Hospital. Sammy herself had done CPR on him for over 5 minutes, but her 5 minutes is a huge reason why his heart was in good shape. And down the road, it gave him a much better chance of having neurological good outcome.
I was really glad when I got to the ER that Dr. Downs was working, because he's a friend of mine because I worked at the hospital.
And then I began to put two and two together, that this was Dwayne, a man I'd known over 20 years, and Sammy, who I'd known for over 20 years. And this got to be pretty intense emotionally for me.
And when I first saw Monty, he goes, Dr. Downs, Sammy, it doesn't look good. And I said, I know.
Dwayne was in the classic situation of his heart survived the cardiac arrest. And now, because he was comatose, the issue was maximize the chance for him coming back to normal neurologically. We've found out in the last few years that cooling people down plays a huge role and gives them a better chance to have a good neurological outcome. And once I figured that out, I called Straub right away and said, hey, we have a man that needs therapeutic hypothermia, and we need to get him over to you.
There is a special invasive catheter to do this. He needed potentially invasive cardiac care, and so the plan to ship him over the ocean to Straub was appropriate because we are a major cardiac center and he had suffered cardiac arrest.
They kept him in that coma, and throughout the night nurse would periodically bring the medications down to see if he would respond, and she said he was following her. So she said that was a really good sign. When he finally realized, hey, everybody's here, and you guys hungry? You want to go eat lunch? We're like, you can't go anywhere. you gotta wait to get better. And he goes, how much better can I be?
From the time he hit Wilcox to the time he went out of our hospital was less than a week. And that's just incredible considering it was a fatal situation at the outset.
And it's been 7 months since my cardiac arrest. To be back to health and being able to walk my last daughter, my baby, down the aisle was definitely huge.
Actually, what I really love about Dwayne's story is that the healthcare system worked all the way from what I call the bottom up, like a pyramid. The bottom plane of the pyramid is really all the people in the community. And the more people who can do CPR, the better off our community is. And then the pyramid starts to work its way up to the first responders, the firefighters, then the paramedics who have medications that they can give en route. Then the emergency room, we have our specialized care with CAT scans. And then the Straub cath lab is kind of the top of this pyramid. And it all came together as one. The chain is only as strong as its weakest link. And in this case, all the links were solid and we had a wonderful outcome.
Layla is our firstborn and she's very outgoing. Just her smile alone would just make my day.
Full of sass, that's for sure. Always dancing no matter who's watching, and loves her brother.
She was 3 years old and in preschool, and her teacher had approached me and had said that she was sort of limping around in school and kind of saying her leg was a little sore. So that was the first indication that something was going on. As she would sleep at night, her legs would just have these movements. And she'd say, "Mommy, my legs, I can't stop. They keep going, they keep kicking." And that was when we knew something was wrong, and we had taken her to the Kona emergency room. And at that point, they didn't know what it was.
The worst part is not knowing how to comfort your child while they're going through something. No one knows what she's going through.
And it got to the point where within the 3 days, she started having like a seizure-like activity where her eyes rolled back behind her head. She got really sweaty and she was moving and thrashing. That was the point where I had to put my foot down and say, take her to someone who can, or somewhere that would know a little bit more about what was going on with our daughter.
Once Layla presented to Kapiolani, within a couple of weeks we knew that we were dealing with anti-NMDA receptor encephalitis. One of the unique challenges with this illness is it's a fairly newly recognized illness. When individuals have anti-NMDA receptor encephalitis, every aspect of their functioning, cognitively and physically, can be affected. The prognosis overall can be fairly good, but it can take a long time, and the illness can be very, very severe at times, and sometimes children can even die.
The thing about her disease is that it was newly discovered, so there wasn't any real protocol as to what exactly can we do.
So there was a good portion of time, I would say several months, where we were trying different treatments, talking with folks all over the country and the world to be able to understand what else we should do and what we can try next.
Just sitting and waiting and seeing her with tubes from both arms to her legs, to not eating, to not smiling. She wasn't even breathing on her own.
Because none of the treatments up to that point had been effective, we decided as a team to really look into starting plasmapheresis. Plasmapheresis is a manner in which to be able to take all of these antibodies out of a person's blood and then put all of the healthy blood and the healthy serum back. One of the challenges that came up is that we didn't have the right machine to be able to do plasmapheresis in such a young child. Once we obtained that machine, we were able to start that particular treatment.
I think at Kapiolani they realized that if we don't have the things that we need to take the best care of a patient, they'll make sure that we can get those things. And whether or not that always makes financial sense doesn't matter to them. It's really about taking care of our patients. And it really seemed that after that time is when we finally saw her turn the corner, where she was making improvements and they were sustained improvements.
Every time she progressed, it was like graduation. She took a step, everybody cheered. Nurses came from Carter to the therapy just to see the progress.
It was just nonstop. She kept doing new things, relearning old things, and it was in her. She just had to bring it out.
Really, the most important part of this end part of her hospitalization was the therapy she received. And our physical therapists, occupational therapists, speech therapists, child life, including Dr. Hirsch and Tucker.
We'll drive past the hospital and she'll want to go and see all her aunties and uncles, and it's not, any doctors. It's all her aunties and uncles and high fives and smiles and hugs. And I think for us, it's awesome to see something so scary and so intimidating for her being somewhere where she finds comfort.
The day she left, we had a little party for her, and so many nurses and so many therapists came in on their days off just to be there to see Layla go home, because it was that big of a deal to all of us, and she and her family had touched all of us that much.
Every rough day doesn't seem as rough. No hard day will ever be as hard as those days in the hospital. And every good day we have is an extraordinary day for us. We're just so grateful to have the opportunity to experience her life with her and to see her grow and to be healthy, vivacious, and full of life, and to be a big sister. She's just our little happy girl.
I was a naval officer and aviator for 28 years, and during that time, a part of that career was as a prisoner of war in North Vietnam during the Vietnam War. I was a POW for 7 years and 9 days. My message is basically reaffirming the invincibility of the human spirit. To plant the seed of belief in people's minds is that we're all so much tougher and capable than we sometimes or frequently give ourselves the credit for.
Jerry and I are married, we're husband and wife, but I also am one of the people in his audience that is his fan. He's inspiring, and he's my hero.
Susan and I were here at home watching television. One of our favorite programs is The Voice, and we used the remote control to fast forward through the commercials.
So I'm sitting there wondering why he is not going through the commercials, because I want to get on to the next segment, the next singer. And so I said, honey, why are you not going through the commercials?
And I didn't answer. And she said, are you trying to piss me off, And
then I realized when he didn't answer then that something was wrong. And I said, are you okay? And I turned around and he said, no.
Something is wrong here. I don't know what it is, but I can't make my hand do the things that I need to do. And that was my first clue that I might be having a stroke.
Immediately, I said, I can't, we've got to get you to the hospital.
And the ambulance took maybe 15 minutes at most to get there. By that time, I'd realized that my right leg was paralyzed and I couldn't move it, which was kind of a surprise. And I'm thinking to myself, boy, this could be a real game changer. Thank God I've made the decision to go to the hospital right now. And then when I got to the hospital, everybody that I talked to or that talked to me reaffirmed the importance of the timing in treating a stroke.
The call came over from the paramedics that they were bringing in a patient who was likely suffering from an acute stroke. As we progressed through the assessment and evaluation, it seemed likely that he might be a good candidate to administer the clotbuster drug to.
Frankly, the music to my ears was that there was a medication that would address the paralysis.
TPA, when administered, dissolves clot anywhere in the body. The medication must be administered within 3 hours of onset of symptoms to be highly effective.
You know, if you don't do this within 3.5 or 4 hours of the onset of the stroke, there's not much chance that it'll work. But knowing that we'd gotten to the hospital very rapidly and we're addressing this all within an hour when it had happened was very comforting.
We began the infusion of the medication. We encouraged him with this, understanding that this can take time.
But by the time I went to sleep and then woke up the next morning after a few hours of sleep, I could actually feel my feelings in my foot and I could wiggle my toes. And that was a huge relief. There's no way I can put into words how the relief that I felt when I realized that my leg was not paralyzed from the stroke.
After he had his stroke, and walking into that room, it was remarkable because you couldn't tell that he had a stroke.
And man, I'm just living my life as normal as I possibly can. I just, as if nothing ever happened.
You know, Mr. Coffey and his story, you know, really illustrates what the goal of Pali Momi Medical Center is for the community, is to provide state-of-the-art care and to help them lead fuller and more productive lives. And the fact that, you know, Mr. Coffey was able to come here to Pali Momi to get treated, that he was treated so quickly for his stroke, again, I think is the main reason why he's doing so well today.
I'm just so grateful. One of my favorite talk show hosts, a man named Dennis Prager, said that happiness is directly proportional to gratitude. And if you stop and think about that, happiness is directly proportional to gratitude. That makes me one of the happiest guys I know.
I feel my mission is sort of to empower people to be able to do what they really enjoy in life and to get the most out of it as possible. Besides being an orthopedic surgeon here at Straub, some of the things that I do include being the orthopedic consultant to the ASP Triple Crown in Hawaii, so I just got started up with that. I am a volunteer coach at the University of Hawaii for the women's track and field team, and I coach the pole vault. Just being a mentor to these young women, hopefully grooming them to become, you know, these wonderful people in the future and paying it forward. But in addition to that, I'm really involved with an annual thing that we call the Kids Fest, and we really try to focus on teaching the community about healthy, active lifestyles.
I've known Spencer, of course, through our workings with patients day to day, and I've known him for the past decade in co-chairing Kids Fest. He is always there saying, what can we do to get a better educational force for our patients?
As a doctor, a lot of times you sometimes forget to take care of yourself, and we get so caught up with taking care of everybody else that we forget to take care of ourselves sometimes. And I was noticing a lymph node on my neck. It was over here, and I didn't feel sick. I wasn't losing weight, and I could do everything, you know, and stay physical and be active, and I wasn't having any problems. So I really didn't think too much about it, except that I know as a physician that, well, this could be more than just a lymph node.
You know, at that point, we were wondering why the lymph node was there and why it wasn't getting smaller or going away, so we decided to do a biopsy. Our concern, of course, was that it could be cancer.
I mean, everything happened quickly because, you know, I'm a busy orthopedic surgeon, seeing 40 patients a day, and right in the middle of my practice, all of a sudden I find out I have cancer. You know, finding out that you have cancer, that's always a scary thing, and I think it was much harder for my wife and my daughter because I could see in their faces the fear and their sadness, and I think that was the toughest part.
Spencer came into my room and told me about his diagnosis of lymphoma. But I told Spencer, don't worry. Don't worry about anything that has to do with work. We'll take care of your patients. We'll take care of all the things that you might have to be concerned about at work, so don't worry. Just take care of yourself.
I all of a sudden realized that I have this huge family, this huge network of people who are out there to help me right when I went down. And they just came to bat for me. They were right there every step of the way. And there was like no hitch. There was nothing that I had to worry about. I didn't have to worry about where my next paycheck was coming from. If I had to take off from work, they were right there every step of the way. We come to bat for every person that comes through this facility, and I didn't understand it any more than I did when I had to go through it myself.
So Dr. Chang received a standard cocktail of 4 drugs, along with a 5th drug that is targeted against his lymphoma cells.
I didn't want the whole world to know that this was going on because I didn't want them to worry. So one of the things that I was able to do, instead of like being treated at Straub, I had the option of going to Pali Momi to get my treatment, and being able to go somewhere that was within the same family and to get equally as wonderful care, was amazing. And then to see somewhat right after the chemotherapy, a PET scan that was completely negative, that was very uplifting.
With Dr. Chang being so young and fit, he really did great through his treatment. He tolerated it very well.
So for all intents and purposes, I'm in complete remission, and what that means to me is I'm cured. This is something where the team came together and we caught it, and so we treated it, and now I'm walking around with this whole huge group of people who are just like walking around with me, and they're never leaving my side. My mission is to first take care of me because I have to do that first before I can help them.